A representative for people with disabilities is calling on the OHA, saying it's falling short on vaccine accessibility. Fox 12's Brenna Kelly joins us now with her story after hearing why the state needs to act now.
These powerful remarks came during a meeting to decide who should get the vaccine next. Leslie Sutton was in the Vaccine Advisory Committee meeting this morning on behalf of the Oregon Council on Developmental Disabilities. She said the OHA is not properly communicated with healthcare providers, vaccine clinics, and local health authorities that people with intellectual and developmental disabilities and their providers are included in Phase 1A. Take a listen to both Sutton's remarks and Rachel Banks, OHA's Public Health Director's response.
There is a promise that is being broken every single day in Oregon when people with developmental disabilities are not getting the access to the vaccine that they are due today. And I just want to make sure that we have, moving forward, a commitment from the Oregon Health Authority that when this Vaccine Advisory Committee acts and says who is in the next phases, that you will implement this with partners in a way that makes that real. Because otherwise, we are providing empty hope to people that need it most. And that is not fair, it is not equitable, and it is not right.
We definitely want to see that the people that we prioritize in 1A for equity reasons, for policy reasons, on the ground are able to get that. We know that that has fallen short. We know that we've heard that people were turned away. And we are actively working with the organizers of these events to ensure that people aren't turned away.
I also reached out to Disability Rights Oregon. The executive director issued this statement saying, in part, when Oregon led the country in making people with disabilities eligible for the vaccine as part of Phase 1, we were really proud of the health authority's leadership. But since then, we've seen health officials really drop the ball by failing to outline a clear, effective plan to actually get the vaccine to people with disabilities. The organization's urging state health officials to make clear people with disabilities are eligible right now for vaccinations and to quickly address any barriers to people receiving the vaccine. Banks reinstated OHA's commitment to working on the problem. She says Oregon's 1A list is more expansive than many other states and says they have more work to do in terms of communication. Reporting in Portland, Brenna Kelly, Fox 12 Oregon.